There are 4 steps every single kidney disease patient should follow if they want to avoid dialysis. Katherine here, welcome to Double Kidney. Patients following the exact same tips I will show you in this video are proven to have way better chances of avoiding dialysis, improving their kidney function, and even reversing kidney disease. There are 4 steps you cannot heal your kidneys without. Nothing else will work if you don't follow the tips in this video. Yes, today we are going to see what you should absolutely do if you want to avoid the risk of renal death according to science. Don't miss our number 1 in particular, because that step was proven in a very large review of studies to be able, even alone, to protect your kidneys from the most dangerous cause of damage there is. Let's start immediately. Number 4. If you have high blood pressure, always do this. Fact: almost 9 out of 10 patients with CKD in the advanced stages are going to face high blood pressure. This happens because high blood pressure is both a cause and a consequence of kidney damage. And while medications are often needed to keep blood pressure under control, following my easy tips can really help decreasing your need for medications and improving your kidney health. Yes! First, reduce salt intake. The consumption of salt raises blood pressure. Unfortunately, ditching the salt shaker is not enough. 80% of the salt people consume every day comes from packaged foods and junk foods. Always avoid them. Instead, eat more foods rich in dietary nitrates. These foods have been proven in many studies to act as vasodilators, opening and unblocking your blood vessels and lowering blood pressure. Great for kidney health and to keep blood pressure under control. The foods highest in nitrate include beetroots and leafy greens such as kale, arugula, chard, and spinach. There are also remedies you should consider. Garlic. Garlic is a must for those with kidney problems. It can lower blood pressure more effectively than prescription drugs, but instead of having a long list of kidney damaging side effects, it comes with extra benefits. I really love garlic. It can lower your blood pressure by 11/5 millimeters of mercury. It lowers blood sugar levels, and when mixed with lemon, it will even be able to lower your cholesterol levels. And also magnesium. Several studies confirm that higher magnesium intake is associated with lower blood pressure. And so many kidney disease patients are low in this key mineral. And while eating foods rich in magnesium can help, many patients will need to take a supplement. This is not always easy, but comes with so many benefits. Magnesium is extremely anti-inflammatory. It makes you more relaxed and it aids sleep. I've explained everything you need to know before starting to take magnesium in my video up here. Watch it now if you have missed it. Okay, one last benefit of magnesium. It fights high blood sugar levels. Diabetes is the #1 cause of renal failure in the world, and if you are suffering from this condition, don't skip the next step. When it comes to reversing diabetes, one of the most important things to do is to always monitor your blood sugar levels. Diabetes damages the kidney and many other organs by slowly eroding the capillary vessels and tissue, decreasing blood flow, and also by causing high blood pressure. What many people don't know about diabetes is that it can be completely reversed if treated appropriately. Fact: what gets measured gets managed. Testing your blood sugar at home with a portable meter is going to help both keeping your levels under control and improving. And also, add more fiber to your meals. Both fiber and fats are proven to slow down the absorption of sugar, protecting from a spike. But while fats are rich in calories, fiber contains none. So don't avoid fruits in a diet to control diabetes. Instead, focus on foods with a low glycemic index. Diet is key to reverse diabetes, and focusing on low glycemic index foods while avoiding those with added sugar is key to avoid blood sugar spikes. To do so, you must be very careful when it comes to avoiding the omnipresent added sugar. And yet, big corporations are doing their best to prevent you from doing this. They hide this white poison even in the most unsuspected food staples. So be very vigilant about your intake of added sugar. And it may seem like there are no good foods left when we start removing everything with a high glycemic index. But this is not the case. I've actually made a video recently to show you what the best high carb foods with a low glycemic index are. In this video, you will be able to see that there are many good options for diabetics that you may haven't considered, including fruit, grains, and even bread. It's up here if you have missed it. Yes, the diet is key to reverse diabetes, but there are also some remedies that can really help. There are two natural remedies in particular I will recommend to every single kidney disease patient. First of all, apple cider vinegar, ACV in short. ACV is not just a dressing, it's a home remedy with powerful healing benefits, especially for people with diabetes. Recent study found out that consuming real, raw, unpasteurized ACV can significantly increase insulin response and lower blood sugar levels. Regular ACV consumption can improve insulin sensitivity up to 34%, which is frankly amazing. And as incredible as it may seem, there is a home remedy even more powerful than ACV. Even though this is not something you buy at the grocery store, it's absolutely worth taking. Berberine. This natural compound is one of the most powerful remedies on earth. It protects the kidneys because it can significantly lower blood pressure, and it also helps with cholesterol levels. But most importantly, berberine is so powerful against diabetes that research is actively comparing it to metformin. Guys, berberine is not something you should take without getting informed. I've made a whole video to show you how to maximize the benefits from this remedy. It's up here if you have missed it. It's almost time for the most effective strategy to stop kidney disease progression you can find. There is solid science to say that this approach significantly reduces the risk of renal death. Before that, let's see some tips that all kidney disease patients should follow. Tips to stop CKD progression. Unless you have a fluid restriction, drink at least 8 cups of water during the day. Drinking enough water protects the kidneys in several ways. It helps them flushing out excess sodium and toxins. It helps keeping blood pressure under control, and it even lowers blood sugar levels. Yes, many people don't know this, but blood sugar levels will rise if you are dehydrated. And also, sleep at least 6 hours per day. Sleeping less than 6 hours per day is proven to have profound consequences on kidney health. Obesity, coronary heart disease, diabetes, high blood pressure, and a shortened life expectancy are all linked to poor sleep. And researchers think that lack of sleep can directly affect the physiology of the kidney, causing serious damage. And also, make exercising regularly your priority. Regular physical activity is one of the best things in the world you can do for the health of your kidneys, your heart, and of your whole body. Exercise is proven to lower blood pressure even in those that are resistant to blood pressure lowering medications, and it will make you lose weight, especially visceral fat, the most dangerous type of fat, faster than anything else in the world. This is very important. Lose weight if you need to. Being overweight can directly damage your kidneys. Extra weight forces the kidneys to work harder, making kidney disease progress faster. Keeping our weight under control also means keeping blood pressure and blood sugar levels under control. Okay, time to see our number one now. This is the proven way to stop or greatly delay the progression of kidney disease. Number one is the VLPD treatment. This is a dietary approach that can really restore the health of your kidneys. VLPD stands for Very Low Protein Diet, a special diet that every single kidney disease patient in the advanced stages of kidney disease should be following. The VLPD treatment has been used on thousands of CKD patients and science has pretty solid data on it. Modern guidelines consider the LPD or low protein diet the cornerstone of the treatment for kidney disease because it positively impacts on the signs and symptoms of the uremic syndrome, on the renal and cardiovascular risk factors related to uremia, and on the progression of renal disease. In 2 words, it works! But for some patients, going one step further and eating even less protein, like in a VLPD, seems to be the key to improving kidney health. This is where this supplement comes into play. This is a special type of amino acids called keto analogs that should always be coupled with a VLPD diet. The reason is malnutrition, because while your kidneys really suffer from breaking down protein into amino acids, your body really needs amino acids. Amino acids are the building block of all the tissue inside your body. Keto analogs of amino acids are nitrogen-free analogs of essential amino acids. Now guys, the very low protein treatment is a very big topic and I've made a whole video about it. It's up here if you want to watch it. And this is all for today. Thank you for watching.